It is February 19, 1994. A woman is rushed into the emergency room at Riverside General Hospital in California. She is confused. She has a high heart rate. It looks like a standard cardiac case. But within minutes, this routine procedure will turn into one of the most baffling medical mysteries in history. Nurses will faint. Doctors will lose control of their limbs. The hospital will declare a state of emergency. The patient's name was Gloria Ramirez, but the world would come to know her by a different name, the Toxic Lady. What was running through her veins? And how can a human body become a biological weapon? Let's dissect the mystery. Gloria was suffering from late-stage cervical cancer. When she arrived, the medical team, led by Dr. Humberto Ochoa, worked fast to stabilize her. They injected her with sedatives and heart medication, but she wasn't responding. So, they prepared to defibrillate her heart. This is where things get strange. Nurses noticed an oily sheen covering Gloria's body. It smelled distinct, like fruit, or maybe garlic. Susan Kane, a registered nurse, went to draw blood from Gloria's arm as the syringe filled. She noticed something impossible. The blood smelled like ammonia. Nurse Kane passed the syringe to a medical resident, Julie Gerchinsky. Julie looked closely at the vial. There, floating in the blood, were manila-colored particles, crystals. Suddenly, Nurse Kane's face went pale. She passed out cold. Dr. Gerchinsky, the resident holding the vial, started feeling lightheaded. She left the trauma room and sat at a nurse's desk. Her limbs began to shake uncontrollably. She collapsed. She would later stop breathing entirely and require days of hospitalization. A third staff member, a respiratory therapist, fainted next. Panic set in. Dr. Ochoa looked around. His strongest staff members were dropping like flies. He ordered an evacuation of the emergency room. Patients were wheeled into the parking lot. Only a skeleton crew stayed behind in hazmat suits to try and save Gloria Ramirez. Sadly, after 45 minutes of CPR, Gloria passed away, but the mystery was just beginning. Why did 23 out of 37 emergency room staff members get sick? 5 were hospitalized. Dr. Gerchinsky spent 2 weeks in the ICU with hepatitis and a vascular necrosis. Her bones literally started dying. Something in that room attacked them. The health department investigated. Their conclusion? Mass hysteria. They claimed the staff was stressed, smelled a bad odor, and panicked. The medical staff was furious. You don't get bone necrosis from stress. So, the Lawrence Livermore National Laboratory, the guys who study nuclear weapons, stepped in. They looked at the medications Gloria was taking. She was likely using DMSO, a home remedy solvent for pain. DMSO is harmless. However, if oxygen is added to it, say, by an oxygen mask in an ambulance, it can turn into DMSO too. Still, that's not toxic. But the lab theorized that when they shocked her heart with the defibrillator, the electric jolt converted the DMSO2 into DMSO4. Do you know what DMSO4 is? It's dimethyl sulfate, a potent chemical warfare agent. The theory is that Gloria's body, through a perfect storm of home remedies, oxygen administration, and electric shocks, essentially turned into a nerve gas generator. When Nurse Kane drew the blood, the temperature change allowed the gas to escape, knocking out the room. It remains the only recorded case of this chemical reaction happening inside a human body. Gloria's family disputes this. They believe there was a mistake at the hospital. To this day, her death certificate doesn't list toxic chemical reaction. It simply says she died of heart failure. So, was it a 1 in a billion chemical reaction or mass hysteria? Let me know your diagnosis in the comments below. If you want to sleep well tonight, maybe don't Google dimethyl sulfate. I'll see you in the next case. Don't forget to subscribe and hit the bell so you don't miss the next medical mystery.